Alright guys, at this point I'm going to talk about familiarizing with the exam content. So here I'm going to talk about two things. The first thing is about the resources that you need to use, and the second thing is about the common topics or recalls. So just hang in there. You're doing an excellent job. I know this is quite long, but try your best to follow me, okay? So just something that I want to highlight here. If you guys are going to learn the resources and the common topics, remember not only to just study them, but you need to practice. You need to put whatever you have learned into your role plays, okay? Keep practicing, because that is the best way to pass your exam. All right, so I'm going to recommend a few books that I personally have used for the AMC Clinical Exam, and these books will really help you for your clinical exam. So the first one that I want to recommend is something called Murtagh's General Practice. This book is pretty amazing for the clinical exam, because here I find it very handy to get certain diagnoses out of symptoms. You can look for the symptoms and then you can find the diagnosis. And Murtagh also gives a list of differential diagnoses. So that is very convenient. And the other thing is you can get a lot of the basic management from Murtagh. So I definitely recommend this book. If you ask me, this is one of the books you should definitely have. The physical book is quite thick. You don't have to get that. You can get the ebook, and that is usually more than enough. The next one is Tally O'Connor. Tally O'Connor is really an examination or a clinical examination a textbook. You're not going to finish reading this whole textbook, and please don't do that. Don't read the whole textbook. All you're going to do with this book is that you're going to find certain sentences to describe the physical examination. So for example, if you're doing the online exam, this Tally O'Connor book has a lot of nice words to use in order to describe certain things. For example, if you want to take a blood pressure measurement, they have a very nice description of how you say that in your physical examination. Whereas if you're doing the face-to-face exam, this book definitely comes in handy as well, because if you're not too sure of the certain techniques, and if some videos are not showing them clearly, you can always compare with this book. And this book is really the standard guideline. If you are following from this book, the chances are it is correct. Okay, so whatever physical examination you're doing, and if they are recommending from, if you're seeing it from Tally O'Connor, that is the correct physical examination. The only question is whether you have enough time to fulfill that physical examination within the 8 minutes. So you need to practice and make sure that you can do it within the assessment time. All right. The next thing is the AMC Handbook of Clinical Assessment. This is an excellent book if you want to only perform role plays. If you want to, keep doing role plays. If you just feel like, I want to do role plays today and I want to do 10 role plays, this book gives you a lot of questions that you can practice. And practicing role plays are important. Like I said just now, it gives you a lot of other things that you need to also work on in order to pass the AMC Clinical Exam. So definitely try to get this book. There are also ebooks for this book, and if you are, if it's possible, try to get the ebook or the actual textbook. All right, let's move on. Here, guys, I'm going to talk about some of the websites that I recommend. Okay, let's move on to the first one. The first one is UpToDate. So some of you might have heard of UpToDate. It's very handy. It's a very powerful tool, this website. I use it when I'm working in the hospital, because the management is very concise, and it's also quite elaborate. If you need explanation, UpToDate has very good explanation. The only catch though is that they have too much of information. And trust me, you cannot use all that information in your actual AMC Clinical Exam. So just be very mindful of that. What you're going to do with this website is, if you have some question, for example, if Murtagh is not giving you the entire management, go to UpToDate, just get that information and come out. Don't linger in UpToDate. Otherwise, you're going to find yourself, enjoying reading all that text which you're not going to use in the actual exam. It's not really a waste of time, but it's a waste of time for the preparation for the AMC Clinical Examination. I hope you know what I mean. Let's move on to the next one. The next one is Better Health Channel. So this is a Victorian government website. What I really like about the Better Health Channel is that they have very good, simple English to, describe a diagnosis. So for example, if you are struggling with describing certain diagnosis or certain medical terminologies, Better Health Channel is the place to go. But one thing to keep in mind though is that Better Health Channel does not have explanation for everything. So there are some things that you will come across that are not present in Better Health. But what I'm trying to tell you here is that before you go and search, the equivalent simple English of that medical terminology, look for it in Better Health Channel first before you Google it elsewhere. The next thing is the Royal Children's Hospital Melbourne website. So they have a lot of clinical practice guidelines for pediatric patients. And I tell you, the management is very concise. They have bullet points on those management. And if you are wanting to get pediatric management, go there first. All right, and Geeky Medic. So this website is quite popular for physical examination. And it's a good place to start if you're trying to learn a physical examination or trying to refresh a physical examination. The only catch in this website is that some of the videos are longer than 8 minutes. So the way that I do it is that I first, write down or learn the type of exams that I'm going to do for that particular physical examination. And then I try to do it within 8 minutes of role play. So the only way you can really improve on your physical examination is to do multiple role plays and modify each of your role plays. Try to fit in within the 8 minutes. All right. So guys, let's move on to the next thing. So here, the reason why I've left this slide is because, at this point, I'm quite sure some of you might be asking this question. Are there any other books or websites that I can use? The answer is, my friend, is plenty. You have so many other books and so many other websites that you can use for preparing for the AMC clinical examination. But my question to you is that, do you really want to do that? Do you have the time? And are those extra resources going to make a biggest difference in your passing? The answer is, in my truthful experience, is no. You don't need so much of resources. All you need is get that questions that you need to role play, do the role plays. And if you have things that you need to find, if you need to find extra management, extra differential diagnosis, then you can use other websites or other books other than what I've recommended. Okay, but before that, I want you to keep things very simple. Okay, just use the ones that I've recommended. Start with that first, and then keep doing that until you become better. If you already have 10 differential diagnoses and you're looking for the differential diagnosis number 11, then you go and find elsewhere. But let me tell you that you don't need so much of knowledge in this exam. All right. And that, my friend, is another certified advice from me. Okay. I'm going to move on to the next part of this, which is the common topics. So common topics are also, or AKA recalls. So recalls are very, very important. I can't stress enough how important recalls are. Recalls are really very close to the actual exam questions. So you must do recalls. You must do, because if I have not done recalls, I can't guarantee that I would pass my exam. So recalls are important. The way that I got my recalls are from the Facebook private groups. Sometimes you can just download it directly from Google. But a hint here though, a disclaimer here, that AMC does not, recommend recalls. Of course, they strictly prohibit that because they want to preserve and, copyright their content. And the other thing is I can't share recalls on my channel because, I want to stay official. And by doing that, I can't share recalls. But I want to tell you guys got to go and find those recalls, okay? The next thing is speak to IMGs who have passed their exam. Ask them question like, hey buddy, how did you pass your exam? Ask them where did you get your recalls, and also ask them what really helped them in their preparation, because those advice can really change your clinical examination journey. And the next thing that I want to share with you guys, I want you guys to take this advice is that practice recalls up to 1 year. Okay, you don't have to do recalls up to 10 years, 20 years, 30 years. 30 years AMC wasn't probably there yet, but just 1 year is more than enough. Trust me on that.